Hello everyone, welcome to The Social Doctor, and this is Dr. Ayushi. The Social Doctor is a platform for the doctors by the doctors, where we help each and every doctor with his or her career growth. And we do that by discussing journeys, experiences, and knowledge from successful medical practitioners. And today we have a very special guest, Dr. Krithiga with us. She is a MDS and PhD in pediatric dentistry. She's doing a research where she is also granted a grant of more than 1 crore from Wellcome UK, and now she's here to discuss about her journey. How did she get this grant? She's the first dentist who got this grant from an international group. And how did they go through the whole journey? If you are into research, how can you also replicate this kind of a journey? And if you are looking for opportunities in research, this is something that you should hear about. So welcome, Doctor, to the platform. It's really nice to have you here.
Thank you so much, Dr. Aishi. Thank you so much.
So, let's start a bit about your journey. So PhD in, after MDS is something very less people opt for. How did you plan to do that? And, how did you gain that interest in research? Because research is something that normally with dentistry, people do not have that much an idea into research after BDS or MDS. How was your journey and how did you end up here?
Okay, so for me, it was not by chance. I was very clear that I wanted to do PhD. So I did my PG in Davangere, in CODS Davangere from 12 to 14. Yes, as you said, research was not great, and we all do thesis, but at least I didn't know much about what I'm actually doing and how I should go about it, although we are trained and all that. So I had my mentor, Dr. Muthu, in Chennai. So I used to come and meet him often. So he was my UG teacher. And when I used to interact with him, I understood that, he was doing great with research and his publications are really hitting. And there was a meaning to research. Like there's really an unanswered question and you're trying to find an answer to that. So I was very clear since from PG itself that I wanted to join PhD, and that too only under him. So the day I finished, I got my results. I finished my exams. The next day itself, I took an appointment from him over the phone, and because he had told me that you tell me after PG, because people usually don't have the same enthusiasm. So the day after PG, I took an appointment and I told him, sir, I'm very clear I want to join under you. So that's how I started. So it was basically some kind of desire which was there. Yeah.
That's very interesting to know, because very less people you see, getting into research. So now, understanding this, recently there have been, some research opportunities that have come up into dentistry very recently, and actually students are looking forward to get into research. What are the kind of opportunities and, that you will like to suggest them on? What is the kind of future that they can look forward to if they get into research?
Okay, so one of the main, I wouldn't say that there are too many opportunities after undergraduation, because the prerequisites, that we need before we join research is we should have a good research background and we should have a good mentor and we should be in a good college and things. So I would suggest, even if you're interested in research, to go through post-graduation first, because that's where you can actually know what your niche is. So a niche, or what we call as a focus area. So all the people are very well known for some particular material or a technique or anything of that sort. They only do research for 15-20 years in just one particular topic. So it's like not even like for example, periodontitis, not just periodontitis, something deep inside periodontitis, like diabetes in periodontitis, diabetic, patients in periodontitis, something like that. So for me, it was early childhood caries. So it's very important that you know what you like. And post-graduation gives you that entire 3 years where you can actually understand the subject and you can choose your niche. So I would definitely recommend post-graduation. And after that, I would recommend them to be like a research fellow, a small part of a big project. Like, if they already have a good mentor and who's doing in the same topic. But the key is you should stay in your topic. And I would recommend them to become a research fellow in a big project so that they understand, and then they could apply for a project by themselves.
Okay. So what I understand from this is that an MDS is the best person to go for. And, if somebody wants to try, then research fellow is the best way to get into what I know.
Yes, because a thesis is compulsory during post-graduation. So you at least have the hang of it. You have some minimum research training for it and all that. So there is some kind of, backup there. Rather than going directly from undergraduation where we're not even familiar about the depth of each subjects, right? Yeah.
Yes, that's completely true. So now when you mention about research fellow, so this is something that, I believe many postgraduates also are looking forward to, even if they want to get into research, understanding what research area is, how, just getting a brief idea of it. Do you suggest to apply for research fellow posts in different places? What is your suggestion?
So there are different agencies like DST, ICMR. So they call for proposals every year. So you can apply it 1 year after MDS, 2 years after MDS. So different proposals have different requisites. And for a research fellow, if you want to be a fellow, you should be a part. Somebody else should be applying it in their proposal. So for example, I'm doing a field study and my recruitment population are 2,000 children. So I need somebody to do the field work. Then I would recruit a research fellow who's completed MDS or completed BDS. So that being a part of that, those kind of projects can actually give an idea, and you can actually make out if you're really interested to be there.
So what is the best way to reach out to these kinds of opportunities is something, if you can help us.
Yeah, so the agencies that are there in India are DBT, Department of Biotechnology, but that is mostly for basic sciences like physiology, biochemistry and all that. So for us, it will mainly be DST, Department of Science and Technology, and then ICMR, Indian Council of Medical Research.
Okay.
So these are the two major agencies that we should be looking out for proposals. And there are a few institutions which are very good in research. So if we go to such institutions like, like the Dental College of CMC Vellore or AIMS or even Ramachandra for that matter, they're already well-versed in research. So when you go, automatically you get opportunities to be a part of small research projects.
Correct. That's true.
Yeah.
That's true. This is nice to know. So are these kinds of opportunities, are there vacancies coming out for these kind of opportunities, or just, people from in-house get involved in this? What is your idea?
So if you want to apply for a proposal yourself, then you will,
So it was more for research fellow, not for the proposal. So, for example, if I want to apply for a research fellow post, but I'm not involved in any of the major institutions, so are there the vacancies coming out for these kinds of posts?
So for a research fellow, we cannot apply directly. So as I told you, if I'm applying for a huge project, there the requisite will be recruitment of research fellows. So I have to tick that option and I have to give that particular person's resume.
Okay.
And then if my proposal is accepted, I can recruit them under my project.
Okay, great.
Yeah.
So now, yes, now coming to the project, getting into research yourself. So if there is somebody who has an idea of research, what is your suggestion to that student or that, postgraduate doctor who has an idea and wants to get into research with this particular topic, how that person should start?
Yeah, so suppose you're very clear that you want to do research and you also know your niche. So the next thing that we have to do is we have to apply for a funded project, because quality research definitely comes through funds. So basically what do we need for research is we need resources, right? So either we need manpower or we need a lot of time to do it. If we're just 2 or 3 people, then we have to do it for maybe 6 months or. But if I double the manpower, then I can do it within a short period of time. So basically, it's all about resources. So so quality research always comes with resources. All of us have done for studies. We all have done our thesis, or we have done small studies, right? So if we have to put it from our own selves, we always try to compromise. We try to get whatever is easily available, and we don't, take that extra effort when we have to put it from our pockets, right? But when it's coming and when it's going to be, for the best, if you have it in you that you want to get the best answer and it's going to reach people, then obviously funded research is the gateway, because there is no limit, right? So you are given everything. So you will only think what is best. How can I get the answer to this question? Not that how can I, save my pocket or things. And what am I going to gain out of this? That will never be there if our monetary benefits are satisfied, right?
Correct. That's
so definitely funded research is the answer, be it any project. So I wouldn't say that the money matters. Even if it's a 10,000 project and it's a survey, it's fine. Okay. So it doesn't matter. The amount doesn't matter. But what matters is, are you able to crack that proposal? And in India, there are a lot of places, it's untapped. There are a lot of proposals, there are a lot of agencies, but it's not tapped by us. And I think as dentists, we lack confidence. We feel that, we feel, I think it's also true that majority of the funding agencies, they fund things like TB or cancer or something which is, life-threatening or which affects morbidity. But now that we have got projects, and my mentors got a number of projects, so it's very, it's obvious that we need to push through, and we can push through. And dental caries is not, a simple thing. It is a disease, and it really affects the quality of life, although it does not affect life directly.
Yes. No, it affects this systemically as well. It affects you. Yes. So now coming to this, we have discussed about funded projects. So how does it make a difference? So what is the procedure for a person to get through and make their project funded is something we want to understand from you.
So before you apply for one, you should have at least 4 or 5 requirements or whatever I'm going to say. The first thing is, we should have a very novel research question. So the research question that we have is treatment A better than treatment B, for example? This question should have been unanswered in research previously. So it should be something very novel, which is not being done before. So that is the first thing. The second thing is, we should be in a very sound institution where, there is no necessity for you to waste time on basic things like a printer, like access to journals, access to textbooks, Wi-Fi. All that should be there. So a sound host institution where research is being carried out, in a routine manner. So that, I hope everybody understands that the funded projects, in the sense, the money comes to the institution. It never comes to the individual. So there should be a system which is already running. So that way, a sound host institution. The third one is definitely a good mentor. A mentor is the one who's going to channelize us. A mentor who is already well-versed in that particular field that you want to work. There is nothing like it, because a mentor can always push us and motivate us, and we definitely need it, right? Unless and until we are really internally motivated. So that is the third thing. And the fourth thing I would say is that funded projects are all teamwork. It's not just one person's hard work there. So it will be of, so for my project, for example, it was, of course, mine, then my guides, Dr. M.S. Muthu. Then I have a mentor who is heading the Department of AIMS, PEDO, Dr. Vijay Mathur. Then we had an external sponsor who's from Korea, Seoul, Dr. Justin Lee. And then I had my other supervisors as well, Dr. Naveen sir and Kalri. So it's an entire teamwork. So we have to make sure that all these things are there in our application before we send it. Yeah.
So apart from all of this, how did you go through this whole procedure? If you can, brief us a bit.
Yeah, okay. So, so as I told you, Muthu sir doesn't take PhD scholars very easily. So he told me to do a couple of presentations, and then he told me to go through courses, and we really have to be worthy of it. Yeah. So after that, he told me that, we will do this the funded way. So then I was not working here in Chennai. I was working in Pondicherry. We were in a different college, and I used to do part-time external. So I was just going through, and I just came across Wellcome Trust, DBT India Alliance, and then I asked, sir, can I apply? And he said, yes, go ahead. So we applied, And very unexpectedly, the proposal went to the next stage. I really did not expect, and it went to the next stage. In the next stage, we have a full application of 50 pages where we have to tell the proposal in detail. We have to tell our mentors, we have to give our CVs of our supervisors. They should tell us, they ask questions like, what is the level of supervision that you expect to receive from your supervisor? Or how do you think this project will lead you have an independent research career path? So you really have to brainstorm and, think about the questions that are there. So that was the next stage. This happened 2 months after I gave my initial application in April. And after that, it came for some more corrections in July. Then it came for an interview, which was like, I was just one step before. That was in November. And that's when, again, we worked so much on the presentation. We have to give a presentation, and then there would be a 30-minute question answer session. So there were like 15 people sitting in the room, and questions just get bombarded from all the sides, from like the top-notch researchers, and half the people are from UK, and they're like too good and so intimidating it is. And then the result came in a month's time, in December, in 17. And then the fellowship starts 1 year after that. So this is entirely a 2-year process. So we really, need to have that financial backup and the patience, to be in the process.
So when you mentioned 2 years, so these 2 years were completely you into a research full time, what I understand, or you were also practicing, so this is mainly why I'm asking is mainly for those people who are, who are also maintaining their family, and, mainly men who also want to get into research and maybe are also the bread earners of the family, or women, whoever it is. So can they manage working, or do you think that they need to have a backup and then get into research? What is your idea?
I was in a college. I was in Pondicherry, but I was in a college.
So you were being,
Yes. So I was working, and then the application process was going on as well.
Okay. So post funding, how are the finances when it comes to research? And without funding, so the idea is there is a norm that research is not something that pays you well, honestly. And people have this thought process. So why am I asking you this is to, understand actually, is it real, or, how does it go?
The agency that we've got, it's like the second toughest in the world after NIH grants, and their scheme, the way they structure the funds is fantastic. So you have to be a full-time researcher. If you do not have a faculty position. So for the first 8 months, I was only a researcher. So they pay you around $1 lakh.
Okay.
As only personal support, and then there is extra given for the study and all, which we can budget when we send the application. The salary will be fixed, but whatever we budget for the study is flexible, that we can do when we apply.
Okay.
So whatever we budget, they will give plus another lakh or so. So yeah, it is comfortable.
But in case if you are still in that stage of not getting funded, how does that happen then? Because you have also passed that phase when you were not funded, when you were on your own. How does that go then?
I really don't know how to answer this. If you're not funded, then we have to self-fund.
Okay.
Yeah.
You need to actually keep on trying for getting.
Yes, there are schemes where they don't pay a salary, but they will fund your project.
Okay.
Yeah, so at least something like that. Yeah.
Okay. So now when it comes to, there are many projects who are government funded also,
Right.
Government also funds you for doing the research. What is your suggestion on that?
Yeah, so as I told you, Wellcome Trust, DBT India Alliance as it's called. So DBT is a government agency, and Wellcome Trust is UK. So they have an alliance. DST I was talking about is again government funded, and ICMR as well. So they're all government funded agencies, not private. Private, for example, in Ramachandra, we have funds like, GATE projects, as they call, for faculty. They provide $1 lakh for if it's approved. And there are small projects that students can do every year. They give 10,000 rupees, and if your proposal is good, for students to motivate them towards research. Okay. So they are all like intramural funds within the university.
Okay, great. So now, understanding all of this, you previously have told that mentor is a very important part of the research, as well as you have different, different mentors in different places also who have been guiding you, apart from, your chief mentor who has pushed you. So how did you, firstly, to select your mentor is also something we want to understand. How did you go through that process as a person to select your mentor?
So, as I told you, my mentor, Muthu sir, was my faculty in Meenakshi. And I was in touch with him since my PG preparation. And every time I used to meet him, he'll give appointment timing specifically. Okay. And the time that he gives you, it will be completely for you. So he used to give me slots like for 20 minutes or half an hour, and he used to give me opportunities to come and present what I knew as my thesis or my cases in Chennai when I was doing PG itself. So he used to really respect and he used to give me opportunities. And how I selected him is every time I used to speak to him, it was inspiring. So every time he would have something to share, there would be achievements to share, and he would always share his knowledge abundantly, not just to me, to anybody. And he was always open to that platform. He was like, okay, you have something which is different, come here and present, let's share knowledge. So he was very open, and yeah,
Yes, yes.
because of that, and he was an expert in his subject. I really wanted to do it under him, to the extent that I didn't even mind taking the topic, because early childhood caries is sir's area of research, but I didn't mind, so it was like that. Yeah.
So now, apart from that, what you mentioned, that you also have mentors in different cities like Delhi, in other places as well, you have mentioned. So how did you go through that? Was it through Dr. Muthu, or was it that you researched and connected and ended up?
No, most of them were through sir only, because for the project especially, we had to submit mentors and external sponsors.
Okay.
So that's how we connected, and all of the connections are Muthu sirs.
Okay, okay, okay. So what I understand, this is having a mentor is one of the major,
Definitely.
make and break for your research. What?
Definitely.
Yes, yes, yes. So great, nice to understand this. So now, what is some key points that you will try to suggest for all those students and all those doctors who want to get into research? Some things that you want to mention there.
Yeah. So I would want to tell them that research is always taken a back seat, and we need a lot of patience and persistence to be on it and to see results. Because applying for funding itself, I already told, it's 2 years. So after that, we plan the study, we do the study, and then for it to come on the paper as a publication takes definitely a long time. But its results will be persistent. Like, if it's papers, like we already have 5 papers and we've given a new classification, that will remain forever. So nobody can, touch it. And for the women, I would say that because a few women have told me that they're interested in research, but they're not able to, change their schedule, or they're not able to give that kind of time and things. So I would want to tell them that I had great challenges during my, especially this project. The main application came when I had just 10 days. I had a 10-day-old baby, and there was this application demanded so much of work, and every time this used to come to me, I used to pray that let this not come back to me. I do not want this again. But it just kept coming back, and so it was really, really difficult for me. And not just me, my husband used to attend a few meetings, and my parents helped me, and it's all a teamwork. So if you have an option to choose your partner and your family, your in-law family, please choose them right. And it's really, really important that you take your stand sometimes. So you have to give, but sometimes you have to take it. Nobody's going to give it to us. Yes.
This is such a nice, such a nice quote that you have mentioned, that you have to give, but sometimes you have to take a stand. And it's for everyone, whether it's women, whether it's men, what you want, you have to take a stand.
Right. Whoever it is, yes, absolutely.
Yes. And thank you so much for actually explaining research in depth, the opportunities, who can apply for it, how you can apply for it, and what exactly is funded research, how it is making a difference in dentistry itself. And for the doctors. It's great to know. Thank you so much, Dr. Krithiga, for taking out time for us and explaining us this in depth.
Thank you, Dr. Ayushi. Thank you for this opportunity that you made this happen, and a lot of people are getting to know this, and they will apply, and then they will find more answers to unanswered questions.
Definitely, definitely.
I like
and
that.
actually, research should happen. India as a country lacks in it, but I believe this is the best place research can happen, with so many people, with so many, fantastic, intelligent minds
Definitely.
running on it. Thank you so much, Dr. Krithiga. Thank you so much, everyone, for joining at this time. I'm sure this discussion would have helped you to understand about research. Do share it with your friends, colleagues, everyone who wants to understand research in dentistry, something that is still not very clear. I'm sure Dr. Krithiga has made it extremely clear, and if you want to know more in depth, do let us know. We can definitely share her email ID, and that could actually ease your journey a bit more. So do think over it, get into research, and actually change some of the unanswered questions as you mentioned. Do follow us on our Instagram as well as YouTube channels. That will also help. There you can also find all our old videos that can also help you with your career growth. Thank you so much, everyone. Thank you so much, Dr. Krithiga.
Thank you. Thank you.
Bye-bye. Good night.
Bye.